Well, Siddhartha Datta is the program manager of Vaccine-preventable diseases and immunization program at the World Health Organization. He joins us now from Geneva. Thanks so much for speaking to us. This must be such a frustrating issue for you. I mean, vaccines were so effective for so long. They spared millions of people from truly miserable diseases. Where did it go wrong? Why was confidence lost in the first place?
I think, like you say, the first point is to make a point that vaccines work. Vaccines have been instrumental in saving lives, instrumental in saving, resources for the government so that the government can invest in a more productive elsewhere. I think the other point, which I just wanted to make sure at the start, is that 90 to 95% parents still bring their kids for vaccination. That's why we see this coverage in our region. However, there are, like you said, small percentage of our population, community, they don't come to vaccination or they don't get the kids vaccinated. I don't think it's a matter of where did we go wrong. I think it's a matter of trying to understand what should be done better to bring this population, which is left out, into the system so that they can start utilizing the value or utilizing the vaccines which are available, and we can offer the value of these vaccines to the population and to the community.
Okay, but when we're talking about Europe, these aren't people that have been left out. These are people that have long known. I mean, many of these parents you're talking about have been vaccinated themselves. They've never suffered from measles or any of these illnesses and diseases. So what is wrong? Where did this kind of complacency come in that they feel it's no longer necessary to get their own children vaccinated?
Yeah, I think the vaccine, we have seen the value of vaccine. Like you said, we don't see these diseases. We don't see polio in the European region. We are seeing less number of measles, but we are seeing some measles cases for sure. So there is a tendency for people to forget what these diseases were and where they were killing the children at one point of time. So there is some degree of complacency for them to see, because they don't see the disease, so they don't come forward to get the vaccines. And I think this is a time, opportune moment, that we keep on reminding that these diseases kill people. Measles have, in the last 2 years, that we have seen around 100 cases of measles deaths and measles-related deaths in the WHO European region. It's a stark reminder for all of us to, appreciate the danger of not vaccinating kids in our community.
Right, and I mean, that's really the most frightening part here. When we talk about what the consequences are for not vaccinating, particularly children, what will it take to convince people? Will they have to see their loved ones suffer and even risk death?
Yeah, I think what needs to be done and how would we address this entire issue is to make sure that people, my parents, every individual who is coming forward for vaccination, get access to credible information, what these diseases can do, what these vaccines can prevent, so that they become better informed in making that choice, making that decision for the kids and for the near and dear ones. I think it needs a collective responsibility, a collective effort from everybody, media, politicians, doctors, healthcare workers, to reiterate the fact that vaccines work, number one. Vaccine had been instrumental in preventing the deaths and making sure that the kids of today or the future of tomorrow can add on to the value of the society, value to the government in future.
Okay, Siddhartha Datta, we'll leave it there. Thank you so much for that from Geneva.